non-governmental organization, St. Ghana, is calling on government to establish a public health emergency fund to deal with disease outbreak in the country. Government, in its 2022 to 2025 National Medium-Term Development Framework, promised to establish a public health fund to help increase Ghana's preparedness in fighting disease outbreaks. St. Ghana is urging government to show some commitment to establishing the fund, especially in the recent Marburg, monkeypox and COVID-19 diseases.
You agree with me that since 2020, when we had COVID up to now, it really has learned us something that we need to look at. Clearly, one has to do it. We were not prepared for it, and it's because we didn't have the needed funds for that matter. But I believe that government was able to mobilize resources for us to be able to stem the tide. What we are calling for is that we wouldn't want another situation where another pandemic hit us and government then have to run helter-skelter to get money to fund the pandemic. It might interest you to know that Ghana has what's called the National Action Plan for Health Security, which has been costed. And so all the intervention with cost estimate, but then when COVID hit, we didn't have the means to fund it. And that is why we think that, fast forward 2022, we are now going to 2023. We heard about Marburg, we heard about monkeypox, and before then we had influenza and the like also hitting us. So what we are thinking is that if you have an established fund, like the way we have Get Fund, that is really supporting education infrastructure. We have a dedicated fund solely for epidemics, solely for public health emergencies. We think that that is going to help. And indeed, if you look at when the government proposed the COVID-19 Trust Fund, you realize that Ghanaians willingly contributed to the fund. That shows us how altruistic Ghanaians are. And for that matter, they are always willing to contribute to a cause. So what we are calling for is for government to kind of change the COVID Trust Fund into an emergency preparedness fund, because the name says COVID Trust Fund. That tells you that it's basically solely for COVID. So we are saying that we have the trust fund that has been established by Act of Parliament already. Why don't you convert that into the Public Health Emergency Fund? So if you have any future emergency or pandemics, then that can be used for that purpose.
Right.
Another thing that we are looking at, because the question is, where do we then get the money to actually operationalize such a fund? One key source is that, we also have what is called the COVID-19 Health Levy, which enjoins every VAT payment, 1% of VAT payment goes into that levy. It might interest you to know that in 2021, we roped in almost 889 million. 2022, this year, the budget that was read, was 1.141 billion. And then in 2023, we are projected to get around 2.5. So this is money that is going to come in as the COVID-19 Health Act enjoins us to get from the levy. The point is that there's COVID anyway, but what we are calling for is that the seed money for the Public Health Emergency Fund should come from the COVID-19 Health Levy. And then once that is there, of course, we'll look at other ways to get it sustained. As I said, Ghanaians are altruistic. We also did some study looking at people's willingness to pay to actually even contribute to vaccine in Ghana during the COVID era. We did what's called altruistic willingness to pay. That clearly showed that, yes, people are interested in contributing to a fund if and only if they are sure of what it's going to be used for. And so that is what we are calling for. There are two things. One, government should change the COVID-19 Trust Fund into a public health emergency fund, and also channel resources from the COVID-19 levy as a seed money for the fund. That is what we are looking at. We are also suggesting that, when COVID hit, everything was at the national level. The district were looking up to the national level to help in the COVID response. So another thing we are looking at is possibly the District Assembly Common Fund, although there are challenges with it, but if the administrator can set up some percentage solely for supporting public health emergencies at the district level, that would also help. But all this one will still contribute to the fund that we are calling for. The good thing is that we have a World Health Organization and other international bodies who are also willing and ready to support various countries, but they have to see commitment. That is what is called counterpart funding. Ghana, we've not performed that well in what's called the joint external evaluations. And so WHO and the like are looking at ways to support various countries. So they support, but they need to see the country commitment. And so establishing such a fund is going to really help us to leverage on, to get, of course, other external inflows as well. But we think that we need to first of all look inward, look within first, and then...
All right, Doc, let me ask you this. GET Fund, Heritage Fund, there isn't a single fund ever created by the government of Ghana that has been used solely for its purpose. It always ends up getting diverted for some other reason, including the COVID-19 Trust Fund. So what is it that makes Send Ghana confident that a fund created to manage epidemics will in any way help manage epidemics and not end up being used for something else, especially by a cash-strapped government such as we have today?
Koyo, you are right on that. I mean, citing the examples of the National Health Insurance and then the GET Fund. But you also agree with me that, irrespective of the fact that sometimes there are diversions, definitely the very first thing they will look at is to allocate some for as education infrastructure, allocate some to the National Health Insurance Authority to make sure that they work. So, I mean, that is given. So I think, and some we think that is a necessary condition to even help in terms of implementing public health emergency-related diseases. The fact is that if you do not have such a fund, then you cannot point to one particular source that you can get it. But what we are even calling for is, of course, based on what you said, and that is the fact, is that in as much as we are calling for the fund to be established, we want it to be in such a way that nobody can just decide to come and then use the fund for whichever purpose that they think they have to use it. So we are even looking at, in terms of the management, who manages the fund and the like. So these are discussions that hopefully we will be engaging with stakeholders to kind of look at it and then see what can be done. But for us, the first necessary condition is that the fund needs to be established where we can really go there. That is the very first source. And then when that is done, we'll, of course, implore on government about the need to use the fund solely for the internal purpose.